Hello and welcome to my channel. In this video we're going to discuss hearing impairment. Hearing impairment is one of the most common disabilities in the world. It ranges from mere difficulties in understanding words or sounds to complete deafness. Many clients do not admit that they have a problem and do not seek health care. Clients hide as a result of fear, misinformation, and lack of information on the condition. Hearing impairment is a broad term used to describe the loss of hearing in one or both ears. There are many different levels of hearing impairment. Hearing impairment, this is the partial or complete loss of ability to appreciate sound from one or both ears, which can be mild, moderate, and severe. Hearing impairment ranges from difficulty in hearing certain ranges of tones or understanding certain words to total deafness. Deafness refers to complete loss of ability to hear from one or both ears. Okay, so when it comes to the types of hearing impairment, usually or mostly there are two major types, because these types are defined according to where the problem is. So the first major type of hearing impairment is known as the conductive hearing impairment. This one, it is related to how the ear gathers sounds. It occurs when there is impaired transmission of sound through the outer or middle ear to the fluid in the cochlea. The sound is quieter but not distorted. Medically or surgically, it is treatable, this conductive hearing impairment, and it may be due to impaction of cerumen in the external ear canal, fluid in the middle ear cavity, or scarring of the tympanic membrane. The second major type of hearing impairment is sensorineural hearing impairment. So this type of hearing impairment, it is related to how the nervous system transmits and translates the sounds to the brain. Usually it is due to the problem with the cochlea, and occasionally with the hearing nerve, which is the vestibular cochlear nerve. Usually it is permanent and requires rehabilitation, such as hearing aids. The common causes of such hearing impairment is excessive noise, birth injuries, head trauma, and also aging. The other types of hearing impairment includes mixed hearing impairment. This is where there is hearing impairment which results when conductive hearing impairment is superimposed on the sensorineural hearing impairment. The other type also is known as the central auditory problem. In this one, hearing impairment or loss has its underlying difficulty in the central nervous system. So hearing difficulty cannot be explained adequately on either conductive or sensorineural basis. Psychogenic hearing loss is another type. It is usually manifested, or it is usually a manifestation of an emotional disturbance, unilateral to evident structural changes in the hearing mechanism. The loss of hearing in this type is often total, but suddenly recovers. Let's look at the etiology of hearing impairment. So the first one is that this hearing impairment or loss can be inherited, where one or both parents or relatives are born deaf, and definitely it means that the child will be born deaf. The second type is where the second cause or etiology is where hearing impairment may also be caused before or during birth for several reasons, such as premature birth or low birth weight in which the baby lacks enough oxygen to breathe. And then there's infections such as syphilis or rubella infections. Then ototoxic drugs or a group of more drugs such as aminoglycosides, where there is gentamicin, streptomycin. Okay, these drugs can also cause hearing impairment. Another same before birth or during birth, we have jaundice, where in a newborn, this jaundice usually can damage the cranial nerve number 8, which can lead to hearing impairment. The third etiology is infectious diseases such as meningitis, measles, mumps, severe cerebral malaria, chronic ear infections. All these, they can lead to hearing impairment. Loud noises is another etiology of hearing impairment. So gunfire or massive explosions, traffic sounds, noisy machinery can damage the middle ear and the inner ear and weaken the hearing eventually. Age is another etiology. So accumulated exposure to noise and other factors, including general body tissue degeneration in the aged, may lead to hearing impairment or deafness, and it usually occurs gradually beginning in the 40s, growing worse from that age. Apart from this, there could be also a direct trauma to the head, as it happens in the road traffic accidents, the serious ones. You find that those are also a contributing factor to someone having hearing impairment. Let's look at the signs and symptoms. So the signs and symptoms of deafness and hearing impairment includes asking to have things repeated frequently during conversations, giving irrelevant answers to questions, inattention and daydreaming, spontaneous performance below the level of apparent ability, hearing much better when watching the speaker's face, tendency to withdraw from activities, necessitating conversations, deviations in speech and sound articulation, delayed speech and language development, more responsive to vibrations and touch than speech and surround environment sound. Also making easy wants known more through use of gestures, signs and like vocalization and speech, behavior suggestion of emotional immaturity such as being demanding, fearful, having temper tantrums, depression, insecurities. Whenever they see others talking, they feel they are being talked about, so they are over suspicious. Also false pride, where they pretend as though they have heard when they haven't. And also they are usually withdrawn from social contact. Apart from those, you also find that they will experience tinnitus. There is a recurrent vertigo and postural imbalance. There is also a feeling of fullness or blockage in the ear. Apart from these signs and symptoms, they have noticed this in a child. There is also, regardless of the intensity of the speaker's voice, the child has difficulty perceiving what is said. Okay. Look at the investigations that can be done. So history taking can be done. Under history, you're going to look at the biographical data. In this one, you look at the age of the client, okay, because age of the client is very important. It's very important because most of the times you find that hearing impairment is in old age. Then under the same history, you need to identify the chief complaint. So where you need to identify if there is any problem with hearing, and for how long, and which ear is affected. Is it one ear or both they are affected? Apart from that, you look at the past medical surgical history of the patient. So you check if there has been any childhood illnesses such as measles, or any infections in the ear such as otitis media, any major illness such as meningitis, any surgery that they've had such as tonsillectomy, adenodectomy. Okay, if they've had any trauma to the head or the ear, any allergies resulting in nasal stuffiness and congestion. Then you also need to do, after that, you need to do physical examination of the ear. Okay, when you are done with the physical investigations, so when you're done with the history, then you do the physical examinations, and then you can also do the hearing tests. Okay, so the hearing tests, mainly they aim for sensitivity and speech discrimination. So sensitivity, you're looking for ability, the patient's ability to hear or respond to stimuli. And then speech discrimination or speech description, this is where you're trying to see if the patient has the ability to clearly distinguish different speech sounds. When you do that, then when you do the hearing test, then you can do the Riney turning fork test, where you compare hearing by air conduction with that of the bone conduction. So a vibrating turning fork is placed near the pinna, then in contact with the mastoid bone. The patient is asked which stimulus is louder. The air conduction route through the ear canal is more sensitive, is a more sensitive route. So you should consider the test abnormal when the sound is heard longer by bone conduction than air conduction. So the clients with sensorineural hearing loss who have air conduction longer than the bone conduction in the affected ear. When you do the Riney turning fork test, you can do the Weber's turning fork test. So this test uses a turning fork to assess hearing. The fork is activated by holding it by the base stem and strike the forked section against the base of the palm. Then the base of the fork is placed on the midline of the client's skull. Ask the client to indicate or mention the ear where the sound is heard louder. Sound is transmitted along the skull to the inner ear. The client should therefore hear the tone equally in both ears. If the sound is on one side, the test should be considered abnormal. After you do the Weber standing fork test, you can also do the finger rubbing test. So this is a simple hearing screen test which is done by holding your hand 8 to 10 centimeters from the client's ear and briskly rubbing your index fingers against your thumb. The client should be able to hear the noise generated by rubbing the fingers together. Repeat the technique with the other ear. Clients with a high frequency hearing loss may not be able to hear the noise generated by the fingers. Apart from the finger rubbing test, you can also do the audiometry. So this one, it is done using an audiometer which is electrically calibrated with the ability to carefully control the test stimuli. Two different types of stimuli are presented, that is the pure tones and specifically selected words. Audiometry is used to quantify hearing loss using acoustic stimuli of specific frequencies at specific intensity so that the patient's hearing threshold for each ear is determined. Measurements are in decibels. The normal adult has a hearing threshold of 0 to 20 decibels. Also, speech discrimination is another investigation that can be done. So speech discrimination measures the client's ability to understand speech when it is presented at a volume that is easily heard. In conductive hearing loss, speech is usually maintained. Okay. Then there's the whispered voice test. The whispered voice test, this is where you need to stand 2 to 3 meters in front of the client, on either side of the client. Okay, you can stand 2 to 3 meters in front of the client or on the sides of the client. Then instruct the client to cover one ear with his or her hand so that one ear may be tested at a time. Shield your mouth so that the client cannot read your lips. Softly whisper several monosyllabic, so such as for example ball, chair, cat. Okay, and you can also whisper several disyllabic, such as streetcar, baseball, high chair. Okay, so when you whisper such words, the monosyllabic or disyllabic words, you should ask the client to repeat what they've heard. So the client should be able to hear and repeat at least 50% of all words whispered. Repeat the procedure with the other ear. It should be considered abnormal if the client cannot repeat at least 50% of the spoken word. Consider each ear separately. So when it comes to the medical treatment, antibiotics should be given for bacterial infections. So examples of such antibiotics, we have benzathine penicillin. Okay, so you can give such antibiotics if there is any bacterial infection that has been identified. Then the corticosteroids can also be given to lessen progressive hearing loss or reverse sudden hearing loss. Antivirals can also be given for viral infections. You can give, for example, acyclovir ear drops. Okay. Then wax softeners can also be given. Okay. So tinnitus is said to be caused by spasms of blood vessels supplying the inner ear, and there is no likelihood that any therapy, medical or surgical, relieves it. Hence, the patient is encouraged to wait for tinnitus to decrease altogether on its own. On the surgical management, so surgery may be indicated for conductive hearing loss. Examples of procedures which can be done include ear syringing. So this one, it is done to remove impacted wax, and also myrigotomy can be indicated. So this is an incision into the tympanic membrane to evacuate fluids. Or you can, another surgical management is tympanotomy. So this one, it is usually performed to inspect the area and repair the damage. Tympanoplasty also, it can be done for persistent hearing loss. It is suggestive of disruption of the ossicles. Okay. So let's look at prevention of deafness. So to prevent deafness, there should be proper care of the healthy ear. Then early and adequate treatment of ear infection should be done. Then there should be prevention of trauma of ear infection. Then early detection of hearing loss is also a must. Monitoring side effects of ototoxic drugs is another thing that should be done to prevent deafness, and also monitoring and avoiding noise pollution, as well as periodic ear examination. Okay. So immunizing children against childhood illnesses, including meningitis and mumps, can be done. So this one, we are trying to prevent sensorineural hearing impairment. So you need to immunize these children against illnesses including meningitis and mumps. Also, immunizing women of childbearing age. So the childbearing age is 15 to 45 years. So you need to immunize these women against rubella before pregnancy. Also, testing and treating syphilis and certain other infections in pregnant women is also one way of trying to prevent sensorineural hearing impairment, as well as improving antenatal and prenatal care. Avoiding the unnecessary use of ototoxic drugs unless absolutely and prescribed by a qualified health personnel and properly monitored for correct use, because if it is not properly monitored, you find that there is an overdose, or the side effects definitely are going to impair the hearing. Also, referring jaundiced babies for diagnosis and possible treatment, because we're trying to prevent this jaundice to damage the cranial nerves, specifically the cranial nerve 8, number 8. Okay. And also avoiding the effects of loud noise through reducing exposure by using personal protection in hearing and engineering control. Also increase the availability of affordable, properly fitting hearing aids and follow-up services for many people with hearing impairment. Avoiding getting married within families with a history of deafness is also one way of trying to prevent hearing impairment. So on this table there is the grades of hearing impairment or loss according to the World Health Organization. Okay, so you can pause the video and read through. Even on this page you can pause and also read through. So these are the gradings according to the World Health Organization. So you need to take note that the grades 2, 3 and 4, they are classified as disabling hearing impairment.